did you get beyond the those boundaries of the HMO? How did you uh, finally get further treatment?
So, not sure if I believe in miracles, but if I do, the fact that the company I was with changed health plans to a
Okay.
standard Blue Cross Blue Shield.
So it was luck.
I remember calling my wife up, and I was so excited. And this was a last minute thing they did, and I said, "We need to pick a plan this weekend because I have to have it in Monday." And she says, "We don't." And I'm thinking she's joking or whatever. And I says, no, 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 I got to let them know which plan we want. And she says, there's nothing to choose. And I still wasn't quite following her. And she said, Mike, you're going to pick the best plan, right? If it turns out we didn't need it or it's in excess, then we could reduce it next year.
Hmm.
But thank God they did because when we went away, we still had all our expenses up here. Then I had an apartment down there, and this Blue Cross Blue Shield program was phenomenal. They provided me $75 a day for food and $75 a day for room and board, and that was really a lifesaver for us.
Wow. Yeah. So that was all timing and luck that
And dumb
happened
luck,
for you.
like they
Yeah.
say, if I didn't have dumb luck, I'd have none at all.
Right. That's amazing. So your treatment then, um, what were some of the lessons you learned during that treatment and how did they shape your?
So, that's a great question. I think the first lesson I learned is you got to look out for yourself,
Mhm.
right? Now, mind you, hopefully everyone didn't have negative experiences like that. But what I knew was if it wasn't for my wife being there with me and standing up for me and calling BS on what this woman was saying, who knows what would have happened if I went another 6 months without treatment. Um, and I realized that we have to take care of our own health, right? So, since then I do talks and, I say, hey, who's responsible for your cancer? And they said, my oncologist. And I said, no. And they said, well, yes. And I said, no, no, you are. And they're like, well, I don't know anything about it. I said, if your oncologist tells you to do something and you don't do it, it doesn't matter what they say, right? So you need to be responsible for your overall health. And there's so many avenues out there, especially today, to get support for things like that.
Mhm. Yeah, that's great. So you've undergone, you said nearly 20 bone marrow biopsies and two stem cell transplants.
Right.
Yeah.
So after we were able to choose the new plan, we actually went down to Arkansas for treatment.
Okay.
Uh, University of Arkansas for Medical Sciences. And we went there because, my wife said, this is the best facility, this is the best doctor. Wondering why Arkansas, right? We were up in the heart of 10% of the top rated NCI facilities in the Northeast here.
Mhm.
And the reason is Sam Walton of Walmart also had multiple myeloma. And that's when they brought my doctor, Dr. Barlogi, over from MD Anderson to University of Arkansas for Medical Sciences. And until somewhat recently, I said there was only one negative, and that's after I left there, everything else stunk in comparison. It was just such an incredible facility there. But Dr. Barlogi, in my mind, was one of the first that was truly into individualized healthcare, right?
Mhm.
So, we talked about the bone marrow biopsies and such. We talked about the hundreds and hundreds of blood work I had done. One of the reasons we went down there was because it was standard a tandem stem cell transplant, right? It didn't matter how the first one went, they did the second one also. And it was interesting when you compare the two. If I went to Dr. Barlogi and said, hey, what's next? He would look at me and say, uh, how do I know what's next? We didn't get your test results in yet. How am I going to tell you what changes we're going to make or this or that? And he had an interesting bedside manner. In fact, two people in the waiting room had said to us, Yeah, we didn't like his bedside manner. We switched doctors, and my wife said, "Do you want to switch doctors?" And I said, "I didn't come down here to make friends. I came down here for the best chance of beating my cancer."
Mm-hmm.
And it's interesting. Once you got used to his style, which was very unique, we actually became friends with him. We've gone out to dinner with him and his wife sometimes. But that's the important stuff, is to remember why you're going to the doctor, right? You're not going there to make a friend. You're absolutely not going there because you want a doctor to say what you want to hear. You're
Right.
going there because they're the professional, they know what they're doing. And, regardless of whether I became his friend or thought he was a jerk the whole time, it didn't matter to me.
Yeah.
Obviously, the first was much more pleasant.
So is he the one who got you involved in the clinical trials, Dr.
No, so that was much later. So,
Okay.
so down in Arkansas, they had what they referred to as internal clinical trials that they
Okay.
ran. So he had um, uh, I was in internal clinical trial 6 or 7, I forget now. And what that was for people who were already treated, which was me from the previous, and people who were high risk. Uh,
Okay.
so it was kind of specialized treatment, and I was down there for, and back, again, this is a dozen years ago. None of these newfangled drugs were out. So it was chemo and more chemo and different classes of chemo. And that's all there was. So I had never I was there for 9 months. Still had not received or been in a sustained remission all that time.
Okay. And what year was this?
This was 2000. I was there from January through September of 2014.
Okay. Okay.
And I finished down there and came back home. And I would fly down there a couple times a year for my checkups. And then he ended up moving up to New York, which made it a lot easier for us to see him. And so about 6.5 years in, I'd still not received a sustained remission.
Okay.
And the doctors, there were 3 of them I was talking with, including the one at Penn, a consultant at Memorial Sloan Kettering in New York, and Dr. Barloghi. And they said, listen, you've been on every treatment except 2, and they're not a good fit for you. I know one of them was an eye issue, right? And they thought that it wasn't worth that risk. I forget what
Okay.
the other one was. And then they started talking about clinical trials.